Well, the seasons, the sun, the water, and just everyday stress can take a toll on our skin. And over at Aesthetic Associates, the newest approach to facial treatments, such as volumizing the cheeks, is available. And this morning, we welcome Dr. Sam Shatkin and his guest, Janice Curatolo. And Doctor, what is this all about this morning?
Good morning, John.
First of all, good to see you.
Yeah, good to see you. Well, you know, essentially, a lot of times at this time of the year, we're not really prepared to do any big surgical procedures. So some of the smaller procedures that we offer can freshen things up, make you look better for those family photos, and really make you look great.
Well, everybody wants to look good for the holidays. I mean,
well, any time of year, but especially around the holidays with the family photos, etc. And Janice is nice enough to be our volunteer today and let us do something for her.
Now, you say volunteer and do something. What are we doing a procedure?
I'd like to. You know,
we have time to boil water and tear sheets? I don't know.
Well, that's why. It's not surgery. It's just minor. Okay. And it's nice because it's a very simple approach, and we can show it on TV, and there's not a lot of, you know, gore that people would be bothered by.
Sure.
But Janice, and she was on the air with us before, and we actually did some fillers in the cheeks, and she's got nice volume there.
This past spring, I believe.
Yeah, it was exactly. And it's still looking great. I mean, it's a nice thing about it. Now,
That's
today.
how good he is. I'm still looking good.
I'm looking to see where do you need improvement.
Well, I wish I could take all the credit, but the products are fantastic now, and the newer products last longer. The one that we use for her lasts up to 2 years, they say. It's called Voluma. But today we're going to do some Botox. I'm going to just demonstrate just for a second. Janice, go ahead and frown. As these muscles start to, you know, move, at that point we want to try to put some Botox in there to relax them and soften up those muscles, and that's what we're going to do today. She also told me just before we went on the air that she's bothered a little bit about the brow coming down. So by putting the injections just out here, and I'm going to show that in just a minute, we're going to relax the lateral eyebrow, we're going to relax the inner brow, so she's going to look spectacular for the holidays. So first off, what we're going to do is mark it. So go ahead and frown again, Janice. So what I'm doing is really highlighting or focusing on those major spots where she's got that muscle contraction, and I'm sure you can see that easily in the mirror or on the TV. Go ahead and relax. All right, do that one more time. Good. All right, so that's one thing, and then go ahead and squint down like you're outside in the bright sun there, Janice.
Great.
Okay, so you're doing good. You're doing good.
Yeah, look up into those lights.
And then so we got a little spot. Go ahead and squint down. Yeah, and then another spot right here on the other part of the brow. So those are the areas that we're going to inject today.
Doctor, how long does the Botox last?
Well, on everybody it lasts about 3 months. It could last up to 6 months. We use only fresh Botox that just recently was mixed every day that we use it, and I did it this morning for Janice. So I think that makes a difference. You know, as a board-certified plastic surgeon, we follow certain guidelines and criteria.
So people don't have to worry about this stuff coming from somewhere else. You put it together yourself.
Well, you have to be leery, you know, consumer beware, but our product is, it's a U.S. FDA approved Allergan product, which there's never any question about its strength and validity.
Well, that's good.
So I have pre-drawn up these things, and these are tiny little needles. Actually, I've used insulin needles, which the diabetics use, and I do that mainly because I learned from my daughter who's diabetic, which she's been on the air with us before.
Okay.
But it's such a small needle, there's barely any discomfort with it. So we've got that drawn up already, and we're going to start with the areas of the frown line.
Now, I would offer to assist, but I don't have any gloves. And
that's all right, Jackie. Stay where you are.
Okay.
Just look pretty like me.
Yeah, right. Okay. There you go. Oh, Janice said something. You know, she talks a lot, so we're happy to have her with us. But okay, so go ahead and frown again. So basically, can you see us? You can zoom right in if you would. That would be great.
Oh, great.
Okay, here you go. So
right
I'm going to identify those wrinkles, and I'm going to try to do it in such a way that you can see on the air.
And so you kind of just follow the...
got it all measured out. I know exactly what we're going to do.
The little dots that
There's always a little bit of a pinch there, but never too bad that she's uncomfortable with. Now, the one thing about Botox is we do the injections right away, and unlike the fillers, which you can see the volume enhancement immediately, with the Botox, you don't see the result. It takes sometimes up to 5 to 10 days to see it. She'll start seeing a little bit of relaxation in about 5 days, and then the rest. So then I'm going to do this area out here. In this area, we're just going to do a couple small units of it just to relax those brows just a little bit.
Okay.
You know, that's the thing. Everybody thinks they're going to see it right away.
Yeah.
Well, that's something to keep in mind. You don't see it immediately, but it's okay. So the key is now Janice
kind of become an instant response.
Janice waited for Janice waited for it to sort of wear off a little bit more, probably because she knew we were going to ask her to come back again with us. But generally, the patients will come back before it completely wears off, and then they can stay one step ahead. Go ahead and frown for me, Janice. There we go. Now relax. Okay, so that that Botox is starting to work already. And I like to compare the Botox to like wearing a shirt. If you've got a shirt that you wear every day, it eventually gets wrinkled because of all the movement. If you if you wear it one day and you hang it up, eventually those wrinkles will relax. So by relaxing her muscles, we're preventing those wrinkles from happening over her lifetime by letting it sort of iron itself out, if you will. And that's the nice thing about Botox.
Now, Janice, let's talk about what you had done in the spring. You said you had your cheeks done.
Yes.
They look absolutely great.
Yes.
Oh, thank you. Yeah, he did here.
I am at the disadvantage of not having seen the before picture. I don't know what your cheeks were like before, but they look pretty good now.
They were down to here.
They were down there. Okay. But they look pretty good
Well,
now.
the nice thing about the fillers when we put in the face, because as we get a little bit older, and I'm not saying you're old, Janice, I just say as you get older,
That's all
you
right.
lose some volume in the face.
I'm 80. Look at how good he does.
Yeah, you look good for your age. But as we get older, this face takes that V-shaped and becomes more of a square shape. So our goal is to relift that, and we call it a liquid facelift, by putting that volume back in the face, making it more angular, which, you know, that's one of the reasons why she's happy, and gives that volume again.
You don't even realize it until you get it done. Then people say, "What did you do? You did something. You look so fresh."
Yeah.
But they don't know what it is.
Do people say, what kind of makeup have you changed to? You look so much better.
Yeah,
they think it's makeup, don't they?
exactly,
Right.
yes.
Sometimes makeup, sometimes hairstyle. You know, they just
Hairstyle, yeah. Are those new shoes?
Well, they don't know what to put their finger
right.
on, but the goal is to make people look a little bit better, feel a little bit better about themselves, and then some of that also carries the confidence with them. So not only are they looking better when they see themselves in the mirror, but now they're carrying a better air about themselves because they feel really good about what they see.
Yeah.
Yeah, and I think that makes a big difference. And these are the procedures that are very simple. Before we get off the segment here, I just want to mention December 10th, we've got a big event at the office. It's for all of our injectables. You can call up and make an appointment at our office. That day, we're going to give 20% off several of the products. We also have services that we're providing with peels, discounted 20%. The injectables, which we just did for Janice, are also discounted. It's a big event at the Aesthetic Associates Center. So if you're interested and you're watching the show today, please, make the effort to make a phone call, because we will get busy.
Is this your location in Kensington, or you've got a new location?
Well, it is at the Kensington Aesthetic Associates Center office, our main office, but we have a new location at the Wyndham Hotel, which is our new Trey O'Ray Spa.
Right.
And we've been on the air to talk about that, but the Trey O'Ray Spa. What's that?
Yeah.
Linda went there.
Yeah,
I think.
Linda's been there. Yeah, we had an on-site, which was great. But that's the services we offer here are slightly different, but we do the facials, we do the massage therapy, we do the makeup, we do nails, and we do hair blowouts, but we don't do the coloring and cutting. But there's plenty of salons in the area that do that. But we do a lot of these other services. It's sort of an extension of what we do at the Aesthetic Associates Center, and we're really excited about that.
Now, Doctor, will Janice require any more now that you've volumized the cheeks?
You better say no.
He's beautiful.
I was going to say, if she needs any more, you're going to have to really point out where it is.
One of the things is after they've had the filler, over time it does diminish. She certainly doesn't need that in her cheeks just yet, but maybe in 6 months or so she may. But a lot of the things we do to refresh the skin, to work on the surface, to help textures, to help discolorations, sun damage and things like that, those are things that are maintenance. Almost on a monthly basis, these individuals will come in and get those treatments. And it might be nothing more than a facial and a light peel.
Now, this volumizing material, besides lifting the cheeks, is that good for smoothing out the wrinkles that you always get from the nose down to the mouth?
Absolutely. We can soften folds, soften lines. We'll use it a lot also on the jowl area, which I don't think she had, but at some point.
I did a while ago.
Oh, did we
I
do
may
that?
or may not have had that.
Yes.
Yeah, no, but we can, wherever we see a valley on the face, we can put some volume in. So if she's got a little valley here, we can almost make that jowl disappear by bringing that out. Okay. And that's just fantastic. And that would be as sort of a preventative, to prevent the need for the facelift. And in Janice or some other individuals, they come in for what I call those a mini facelift, or what I call the S lift, which is a short recovery facelift, sort of like a weekend lift. I mean, those are surgical procedures. So, what we're talking about today is predominantly the non-surgical things, but we do all that those other things too. And we've been doing that for 25 years at the Aesthetic Associates.
Well, Doctor and Janice, thank you so much for being here. This has been really inspiring and informative.
Well, I want to also just tell you happy holidays.
Happy holidays
time
to
of
you.
year to look your best.
You and your family, Janice. You're a trooper. Thanks for being with us.